cannot afford to see it go to a doctor. And I'll explain it to you like this. When you make $600 a month, I work 15 hours a week at $10 an hour for these people, and that's what they're able to pay me. You pay your rent, you pay your lights, you pay your gas, and you get you some food out of it. Well, if you go to a doctor and have to pay $70 for a visit and $30 for the medication, it doesn't seem like much to somebody that's making $150,000 a year, or somebody that's making $80,000 a year. But when you're making less than $8,000 or $9,000 a year, and you're living off of that, and you're working to make that kind of money, it comes hard, because that $70 that you go to the doctor and he tells you come back in 2 weeks, see, you got to be crazy. I'm going to take this little prescription and pray to God that I be okay. So there has been no preventive medical care in my life anymore.
But I've discovered that there are thousands of families here in Missouri who do not have health care. And somebody in their family are dealing with life-threatening illnesses. They cannot afford to buy health insurance. And all their family members can do is watch them slip away because they cannot afford to pay for the medical treatment and medication that would help their loved one to survive. If I could speak directly to the politicians and the citizens who oppose the expansion of Medicaid, I would say to them, you probably have health insurance that covers you and your family, that protects you. But what would happen if you suddenly found yourself without that insurance and one of your loved ones came down with an illness that was life-threatening? What would you do? Thousands of families face that truth every day.
Based on what Reverend Taylor has said, what Ralph Winslow has said, and what Dr. Archer has said, this is extremely important for Missourians across the state because it is not only the smart thing to do, but it is the right thing to do. And we will be working to make sure that our elected officials know that Missourians want to see this investment in our state and in the people that reside within our state. So if you're interested in joining the campaign or to learn more about it, please visit www.momedicaidcoalition.org. And if anyone has any questions, I'm sure that they would be more than willing to answer. Thank you for coming out today. We appreciate it, and we look forward to moving forward and making sure that we get this to happen in the state of Missouri.